Well, the updated mask guidelines also raising questions for the roughly 10 million immunocompromised Americans, with growing concerns the vaccine is actually less effective for them, and particularly for organ transplant patients. A new study looking at antibody levels in transplant patients after each dose of the Pfizer or Moderna vaccines, finding 46% had no antibody response after either dose, and only 15% had a measurable response after each dose. Joining me now, one of the researchers behind that study, Dr. Dorry Segev, a transplant surgeon at Johns Hopkins. Dr. Segev, thank you so much for joining us. Put this into perspective. This seems really upsetting. What are the implications of this lower antibody response?
Yeah, good morning, and thank you for having me on the show. This is problematic. So half of transplant recipients who've gotten both doses of the vaccine still have no detectable antibody, and that means that they cannot consider themselves to be protected in the same way that all of the guidance is coming out for vaccinated people who can go back to resuming the activities that they had before the pandemic. Transplant patients and other people on immunosuppression need to be much, much more careful. And of course, now with relaxation of mask mandates, the world is going to be much more dangerous for them.
So just to be very clear, they need to have the same masking and social distancing guidelines as before the vaccines, correct?
Yeah, the thing I'm telling transplant patients is get vaccinated, but act unvaccinated, meaning that follow the guidelines that the CDC has for unvaccinated people for the time being, because we cannot be sure that immunosuppressed patients have that level of protection enough to follow the vaccinated guidelines right now.
We're talking about transplant patients, but what about for other people who are immunocompromised? Do the same rules apply? Do they need to act as if they haven't been vaccinated, even if they have been?
So there's certainly emerging evidence, not just in transplant patients, but in people taking immunosuppression, for example, for autoimmune diseases, in people with cancer on chemotherapy. There's growing evidence that if you have something that compromises your immune system, you may not have the same level of protection from the vaccines as people with normal immune systems. And so, the general recommendation is, if you have some condition that is compromising your immune system, talk to your doctor about what implications that may have. But the time is not yet now to relax all of your protective behavior.
And doctor, what's being done to address this? In other words, how much longer should people who are immunocompromised expect to be in this limbo?
Well, we're studying a lot of the different aspects of the immune system, so we can measure antibodies, but there's also B-cell immunology, T-cell immunology. I think the next few months will give us a lot more information about what's really going on in the immune system of people who are immunocompromised and what the implications are for protective immunity. So what level of immune response do you really need for you to be protected from what's going on with the virus, across the country?
All right, Dr. Dorry Segev, thank you so much for sharing those details about this new study. Really appreciate it.